Colgate has been partnering with both the Ministry of Health and the Kenyan Republic in reducing dental caries and indeed all dental diseases for a very long time. And this is yet another product that is going to help us prevent cavities and make the health of Kenyans better in as far as teeth are concerned. The only survey that has ever been conducted in Kenya in 2015 showed that 5 in 10 children had dental cavities at the age of 5 and below, and in adults, 3 in 10 adults have cavities. Now, what can we do to reduce the burden of cavities? We know that treating dental caries is very, very expensive, so we can do a lot in prevention. And we also know that the origin of cavities basically is because we are taking more refined food than what our older generation was taking. So that awareness to the Republic that it is what causes cavities is the refined foods, and especially free sugars, would help us reduce. But as a government, we need to invest more in oral health promotion and disease prevention, and partner more with companies that Colgate that do this. We need to also train more dentists, because at present we only have 1,000 dentists from the time we started training dentists in the year 1968, which is truly not acceptable. We could do better. And with that, conversation is going on to see whether we can increase the capacities of the only 2 dental institutions that train dentists, or to increase the number of dentists that are trained in the institutions that we already have.
We've been fighting the fight for cavities for a very long time. I oversee a program that runs within the schools. It's a schools-based program that does oral hygiene education and hand hygiene. And as Dr. said earlier, we've really been in this because BSBF began in Kenya in 1968. And over the period, we are still seeing that there's a lot of cavities, and the fight still needs to go on. So it's about how do we make it better, because education has been happening. Yet when we look at the numbers, when we look at the statistics, we still see that there's a lot of cavity, and especially within the children, which is very worrying. What we are finding out is there's a lot of free sugars, and especially now we've gone juices, we are doing cakes, and it's us parents who pack these things for the children when they go to school. And without education, because awareness also needs to be there, we've learned that we have minimum number of dentists within the country, meaning we cannot have enough dentists for the population. So Colgate is purely and just passionate about prevention. That is what we do with the schools. So technology has come on board to also support this. In as much as we are doing education, this new product is going to be an additive onto that, because it's strengthening the teeth, meaning even as we do education, as people change their habits, because it's all about habit change, as people change their habits, then we also have a toothpaste that is helping to counter what is happening.
The new CDC